Lee. I'm so honored to introduce you. This is Dr. Mara Weinstein Velez. She's a board certified dermatologist and director of cosmetics and laser surgery at the University of Rochester Medical Center in upstate New York. You're super passionate for healing, communication, artistry, beauty, and psychology, which has led you to pursue a field in dermatology. So we are super excited to have you today. I have a bunch of questions. I'm sure all of our viewers do as well. So to kind of get started, I'm interested to know how you got into the field of dermatology, if there was anything personally related to you that kind of inspired you to join.
Yeah, that's a great question, and it's so chock full of background. So I'll try to keep it short. So I grew up on the island of Guam. So it's a little tiny island in the South Pacific. Not many people know about it. So if any of my Chamorro friends are watching, thank you so much for being here. And I struggled growing up with acne, and I tried, pretty much anything I could get my hands on. My mom was super passionate about skincare and has like the most beautiful skin. I'm sure you've seen her pictures on my page. And so I just wanted my skin to be like hers, and I couldn't understand why I kept breaking out. On Guam, there were no dermatologists, so there was an access problem. I didn't even know that that was, that existed in terms of somebody who could help me. And so I was, subject to most of, our listeners to sort of the overwhelming consumer, like, I don't know what to get, go to the drugstore, pick everything, try everything, don't stick to a regimen. And so that's sort of how my interest grew in dermatology. Um, on the other end of that, as I got into med school, I also realized that sort of the breadth of dermatology was just so fascinating. I mean, we have the opportunity to not only treat and cure skin cancer, we also treat children. I do see a lot of babies in my practice. We treat geriatric patients. We look at slides under the microscope. We do surgery. So there's so many ways to touch a patient through dermatology, and that's really why it resonated with me.
That's so awesome to hear. Do you see a lot more people coming in for dermatologist appointments since COVID? Because I feel like a lot of people were really hesitant to come in and sit with the doctor and take their mask off. Has it changed at all? Is it still kind of an issue today?
We have seen, I think it's been a pretty steady flow of patients. I can say that I've seen a ton of new patients because of COVID. I definitely have heard new concerns because of COVID, primarily that being, the Zoom, you know, a Zoom concern. So, I look a certain way on Zoom and I don't like it, or I'm noticing, this stands out, or this hyperpigmentation on my skin is more visible on Zoom. And, in a way, it's nice because it's really forced people to take better care of themselves. So I think it's had a lot of positive impact on mental health in that they're now taking that step to address something that bothers them. But on the other hand, we have to be careful because we don't want to nitpick every little thing, because people can get carried away. So I hold that as a personal responsibility to guide patients as to what decisions to make in the office, when it comes to cosmetics or, tweaking little things, if that's really going to help, or if they start getting carried away. I definitely keep a tab on that.
Of course. And as we're spending a lot of time home over the past year, I guess for the people that are watching and just in general, what is the best way to determine that we are having healthy skin throughout this past year? How do we know? Is there any way that we can figure it out at home? Do we have to come in for a dermatologist appointment?
Yeah, that's a loaded question. I think we can factor in a few things to that equation.
Of
First
course.
off, we know there are telltale signs on your skin of, what stressed out skin looks like, or what dehydrated skin looks like. So at home, if you're noticing more inflammation, more dryness, more skin sensitivity, let's say you're breaking out a little bit more, or even your skin is looking more crepey and sort of dehydrated, those are all signs of stressed out skin. And so that should be sort of your, wake up call that maybe you should take a second look at your products, or, seek help from a dermatologist to try to negate those effects of stress on the skin. Simple things you can do at home is start a, good skincare regimen. I think there are some pillars when it comes to good skincare regimen. Definitely wash your face at least once a day. If you have sensitive or dry skin, once a day should be plenty. Look for something that's a little bit more on the creamy side, something that won't strip your skin of its natural oils, something that leaves your skin feeling soft and moisturized when you finish washing. Secondly, I think a staple to any skincare regimen when it comes to healthy skin is antioxidants. And so
Okay.
yeah, so that comes in the form of like vitamin C, for example. And there are just a ton of options out there. And then thirdly would be your sunscreen. So, even if you work in front of a window, or you are driving all the time and you're not directly in the sun, that UV can still affect the skin and lead to accelerated signs of aging. So, at least in the morning, to have a routine that can help sort of reverse the effects of stress and aging on your skin.
What would be the reason that some people are more susceptible to sunspots and hyperpigmentation?
Yeah, that's a lot. We're seeing a lot of that as well. There are a few factors that go into, development of sunspots. So first off, clearly not wearing sunscreen.
Of
And
course.
those examples that I mentioned, right? So people say, well, I don't go outside, but, I have 3 big windows in my office and I'm aware
Exactly.
that,
You're riding a car, you're still sitting
yeah,
outside. Realize.
exactly. You have to wear sunscreen to prevent sunspots. When we see people in their older decades, or in their 50s and 60s, a lot of the sunspots that pop up are from the past. Like, it's just cumulative sun damage that's sort of peeking through. And there's ways that we can help that in the office with some laser treatments. When you talk about hyperpigmentation in acne patients, for example, it can look differently on different skin types. And so on darker skin, hyperpigmentation can look like, brown spots that are left over after acne eruption. On lighter skin, it can initially look kind of pink and then turn brown. And again, sunscreen is your best friend there to help to prevent that discoloration.
Okay, awesome. And for breakouts, right? I feel like a lot of people don't really know what causes the breakouts, but we kind of forget that whatever we're putting in our bodies is usually coming out of our bodies at one point. Is there any kind of food that we should stay away from? Are there ingredients in serums or washes that we should avoid? What, I guess, would be the best thing to do for someone with, for instance, you have sensitive skin, you're breaking out a lot, as someone in their comments mentioned, like maskne has become a huge term and problem today.
Yeah, no, absolutely. So I'm going to break that question down into
Yeah,
2 parts.
go for it. That
Yes.
was like a loaded question.
The first part of it is, what can we put in our bodies, or what should we avoid? I think you mean when it comes to like foods and different things that will
Yeah,
help to
I
avoid
think
break.
a lot of people think it has to do with sugars. So I feel like there's a lot of facts out there, but they're not either proven or they're not classified as true.
Yes, for sure. And you're absolutely right. There is limited data when it comes to, what we eat and how that affects our skin. But we know from, there's some pretty good studies supporting that dairy can lead, a lot of dairy in the diet can lead to breakouts. And the second thing would be foods with high glycemic indices. So this is like refined sugars, carbs, even fruits like grapes are very, very sweet, have a high glycemic index. And so consuming a lot of those types of foods can make breakouts worse. Some other things I talk to patients about are protein. So especially if they are having acne on their chest and their back, some of my male like bodybuilder patients have a lot of issues with breakouts, and oftentimes we nail it down to, protein supplements. So there's a lot of different sort of theories out there. I can't cite, any particular studies that say, yes, don't eat this or don't eat that and you won't have breakouts, but certainly to limit your dairy foods, and limit your food like sugars, candy and things like that. You should notice an improvement in your acne if that is the root cause.
Yeah, I'm like laughing because I was eating grapes last night and now I'm thinking to myself, like, I probably shouldn't have done that,
Well, just everything in moderation, right?
Exactly. Everything in moderation.
Yeah.
I saw you spoke about in one of our magazines about like that balance with your skincare and health. So I think that's super important that we remember there's not many things we should always avoid. We just need to kind of keep a balance to keep our skin clear. And that kind of goes into like a skin regimen. Would you suggest a skin regimen morning, night? What's your like go-to way to keep your skin kind of glowing and shining? Everyone's like goal skin, I would say.
Yeah. So I think that first of all, it's important to know what type of skin you have and how your skin responds to certain products. As I was mentioning before, I think that having your sort of pillars in your regimen is so important. So I said in the morning, cleanse, vitamin C, sunscreen. And then you can add, different things based on your specific skin concerns for your morning routine. And at night, definitely cleanse your skin and use something that promotes cell turnover. So, the hot topic always is retinoids or retinols. And they are so important as part of your skincare routine if you can tolerate them, because they do promote cell turnover and help to boost collagen production, which is something that we all lose um, gradually as we get older. And collagen production, boosting the collagen production in your skin is really what's going to help give it that glow, help it to not look so dull, help to prevent the formation of fine lines and wrinkles and that crepey texture. So those would be my sort of pillars in my skincare routine. Cleanse, vitamin C, sunscreen in the morning, and then you cleanse. Again, I do because I have a little bit oilier skin, but if you prefer, like a like the micellar water, for example, that would be fine as well. And then a retinoid. I always like to start with prescription, low percentage retinoids, and then back off based on how patients tolerate. If you haven't seen a dermatologist and you want to start with something simple over the counter, you can use, there are a ton of good retinol
Yeah, I was
products.
about to ask you, what are your favorite like skincare products? Do you have any recommendations? I know a lot of people here commenting that they love vitamin C and retinols,
Yeah.
and I guess what would you recommend if it was over the counter at least and you don't have that option to go into the dermatologist?
Yeah, there are so many good skincare lines. I tend to support skincare lines that are backed by science. So I've seen all the clinical
Okay.
studies, are involved in some of them. One of my favorite lines right now is Alastin. They Alastin. They make a wonderful retinol product over the counter. Alastin has to be purchased through a doctor's office, and so it might be a little bit harder to get your hands on. But if you wanted to start somewhere simple, Neutrogena makes a nice over-the-counter retinol product. It comes in a silver bottle. CeraVe is also a great brand that just came out with a retinol product. So there are tons of good brands, on the shelf at your drugstore, and then also dispensed through the doctor's office.
Would you recommend these products for men and women alike?
Oh, absolutely. Yeah. That's something I think you and I touched on earlier, that
Yeah,
men,
we did. We were
they,
talking about how like a lot of men have this like hesitation towards skincare, but in reality, skin, it's the first thing you see on your face is your skin. So it's so important that men do understand what they can use, what they can't use. Not everything is made just for women. Skincare's. I'm just like looking through these comments, and a lot of people are like, someone just asked which skincare products would you recommend for men. So that kind of like made me think about our conversation the other day, which is hilarious. Would you, okay, I'm gonna like go through these quickly. Just do like a quick round of questions. Would you recommend microneedling at home?
So that comes with hesitation because I think that it can be practice. But there is a huge concern about how those drum rolls, usually they come in like little drum rolls, are being sterilized. And so
Okay.
if you have a really good sterilization method, including allowing the device to dry completely in between use, and you found that it helps with brightening of your skin or improve your texture, I think it's fine. I would be cautious with microneedling and then trying to deliver or, deliver new products onto the skin after microneedling. We've seen reactions in the office from patients who've tried to do that at home. So if you find a drum that, works for you and you have a good cleansing routine, I've heard of, patients having really nice benefit from it. But it's definitely not going to do as much as the devices we use in the office will do.
Yeah, of course. I think I've seen like a lot of trending, there's definitely a lot of trending skincare products, whether it's on TikTok or Instagram, and a lot of people have been using them and using them improperly. So I'm sure on your side of things, you've also seen the side effects.
Yeah.
So it is so important that when people are going to use these types of products, they have their research behind it. They know how to properly use it. They're not applying too much skincare products before or after. So personally for me, I probably would avoid it because I'm the type of person that would manage to screw up my sensitive skin. But for other people, sometimes they're a little more risky and don't really mind trying it out. So I think it's all kind of dependent on the person, especially for someone like me who has dry skin and is also has sensitive skin. Can you recommend a good over-the-counter body wash for extremely dry skin?
Yes, so I love Olay's new line for body
Okay.
wash. Oil of Olay has a new line out. It has retinol in it, but it also has, I believe, shea butter and a bunch of very nourishing, hydrating ingredients. And I would try that first off. If you're somebody who has very sensitive skin, then you want to avoid products that are very heavily fragranced because that can always be an issue. And if that's the case, then I love Dove Sensitive Skin Body Wash. It's unfragranced, it's hydrating, it doesn't strip your skin. And so just, take note of your skin type before you run to the shelves. I think that I was going to mention too that there are so many dermatologists now who are offering teledermatology appointments. And so even if you make one appointment to sort of just set up a skincare routine, that's okay. That's what we're here
Are
for.
you offering them as well?
Yes, I do offer telederm appointments. We ask that you send pictures prior and we take a look and then, we'll see you live and can make a plan together. And I'm happy to do that. Because I think that we do waste a lot of time, trying to find things that work for us. And you could just spend that same money at one appointment and get sort of you know what I mean? Like
No,
just get
I
a
completely agree. I completely agree. I literally just made a a dermatologist appointment with my person at home because I'm located in Miami. Um, I literally go just to ask questions. Usually, that's what the whole point of my appointment is because, as I was saying prior, like if you have sensitive skin, you have to be so cautious as to what you're putting on your skin, as well as consuming or using to cleanse it or dry it. And a lot of the times, I'm tending to, I guess, put more on my skin than necessary. And I
yeah,
think that's a huge issue because a lot of people see these skincare lines and it comes with 20 different steps to
yes.
the skincare product. And you're like, okay, so should I be using all of these steps? And it's almost like, do you believe less is more or should you be using more?
Yes, I'm a firm believer that less is more. I definitely do a skincare audit. I just posted on that actually when patients come in. I do a little skincare audit, divide things and start with the basics, and then we can always add if we need to.
Exactly. And just to like kind of go back to all these questions that are being thrown our way, I saw here, which is super interesting, and it just hones in on pregnancy. So, what types of products would you recommend for dry skin that's caused by pregnancies?
Yeah, that's a great question. I think that before we go into like products for dry skin, it's important to know what products to avoid in
Okay.
pregnancy. Sort of everything else is at your disposal. I think you could use what works for you. Um, but there are certain ingredients. So the first is salicylic acid. So let's say that you are acne prone and your acne gets worse when you're pregnant. You definitely want to avoid anything with salicylic acid, which can also lead to dryness. The second ingredient is benzoyl peroxide. And these are both, drying, but very common acne product ingredients that patients might not know about when you go to the drugstore to treat your acne while you're pregnant. Have very dry skin while pregnant. I like the products that have ceramides in them. So CeraVe, these are all ceramide products. CeraVe has this nighttime jar, essentially, of a moisturizer that you can use on your face, on your body. It has sort of um, purple branding. I'm sorry that I don't have the exact name for
No,
you, but
no
I
worries at all.
follow up. Yes, but I was for products that have ceramides in them to help nourish that skin while you're pregnant. Also, oils. Um, I love oils for the belly when you're pregnant. Definitely get some good oils. There's a sesame oil, body oil by Neutrogena that I just lived by when I was pregnant. So yeah, don't avoid your oils on your body if
Would
you.
would you say that when people are pregnant, they should avoid like skincare treatments? So, for instance, like a chemical peel, just because you're a little more sensitive, I would presume, at the time.
I don't think so. I see a lot of patients who are pregnant who want to do something for themselves, and I think it's so important to continue that self-care. You know, you're growing another little human being inside. Part of them being healthy is you being healthy and sort of taking care of yourself. And so there are chemical peels that we can do in the office that are glycolic acid based, which is perfectly safe in pregnancy. And so if you were to get a peel or, facial, I would just make sure that all those ingredients that they use are safe. And for me, in my practice, we use glycolic acid peels.
That's awesome. I've been interested in a peel. Would you recommend someone of a younger age? So like for instance, I'm 23. So would you recommend I kind of wait longer to get a chemical peel just because they are stronger, I would say? Or can anyone of any age receive a chemical peel?
Yeah. I think chemical peels are wonderful at any age. There are so many different types, so really it'd be about, what you want to target. If you just are looking for a nice facial refresh and just like a little bit deeper of an exfoliation, glycolic acid peels will help with that, and they're also hydrating as an alpha hydroxy acid. And so that's a great place to start, I think, in your 20s, just as sort of a maintenance plan for your young skin.
Okay,
Peels are,
good. I might have to fly there. You might see me soon. You never know. uh, Especially with like the winter time, I feel like I mean, in Florida we don't really have that issue, but up north, you guys are so susceptible to drier skin,
yeah,
especially the cold air. Would you say as you guys up north transition into the winter time, what would you recommend to avoid dryness of skin? Just like moisturizing,
yeah,
oils, kind of mentioned prior.
yeah. So I love for winter skincare, I love to start what I call the moisture sandwich.
Okay.
And we
Like
use,
that. That's good.
yeah,
You should use
that's
that.
pro tip. No, once or twice a day. Basically, what that means is you're going to cleanse your skin in the morning. Don't dry it off completely. Let some of those beads of water, still kind of fall off the face. and then apply a hyaluronic acid based serum. There are so many out there. There's Hydro Boost by Neutrogena. There's Mineral 89 by Vichy. There are just a ton to choose from. So a hyaluronic acid based serum. And then on top of that, you're going to use a creamy, thicker moisturizer. Like I mentioned earlier, CeraVe makes one. Um, Elastin makes one. They just came out with a new product called the Ultra Light Moisturizer. There's heavier moisturizers, but if you layer your hyaluronic acid with your moisturizer, it'll really help to lock in and sort of seal in that moisture so that your skin feels hydrated all day. And then at night, you're going to do the same thing again. I think that just remembering to add that extra layer is so important, especially in the winter.
Of course. And would you, I guess, say this is probably something a lot of people think, since it's snowing outside, where's the sun? Would you always recommend putting sunblock on regardless, snowing outside, sun outside, no matter what temperature it is?
Oh, yes, 365 days a year. I think our viewers will probably agree that, or, by this point, know that we recommend sunscreen every single day. And I can't tell you how many patients, and if any of my local Rochester patients are listening right now, thank you so much for joining. And I'm sure some of you, we talked about it this winter, or excuse me, last winter, came in and, said, I saw a post on wearing sunscreen while you're skiing, wearing sunscreen when it's snowing. And I didn't do that. And now look, right? And they come in with,
exactly.
come in with like a goggle tan from,
No.
it's,
That's the worst. Wow.
yeah.
Yeah, definitely. I mean, I use a lot of skincare products that have sunblock in it already. Do you think they're as effective though? Because I do know there's like, for instance, there's CC creams, which are considered like, um, what's the word? Like a, oh my gosh, I can't think of the word. This is not good. Like the CC creams for like that you use for your makeup.
Yeah. Yes. So I think that if you are going to be in direct sunlight, in Miami, gosh, it's tough. Every day you could be exposed to a significant amount of sun. I think that if you're in someplace warm where there's always sun, then you definitely need to layer with a sunscreen. The CC creams have, there's some great ones by Dermablend, for example, that have like an SPF of 50. And I love those, but I definitely put sunscreen even on top of that.
Foundation. That's the word. That's the word.
Yeah, foundation. Yeah.
There we go.
The foundation. Yeah, I think and something I posted on TikTok, which got a lot of attention last year, was, if you are trying to achieve an SPF 30, for example, if your facial moisturizer has SPF 15 in it and your sunscreen is SPF, 10 or 15, those don't equal SPF 30. So
Exactly. You recommend SPF 30 regardless.
correct. Yeah, 30 or higher.
Do you find that the higher ones work better? Or do you think, I've heard personally it's like a myth, you really just need 30, but is that true? Do you think it really makes a difference if it's 60 or 75 versus 30?
Yes, we do have studies that show that the amount of SPF truly matters, but it's in a matter of, a percentage, for example. So at SPF 30, you're getting about 97, 98% coverage from UV rays. At SPF, 100, you're getting between like 98, 99% coverage. So it's minimal, but I think the most important part of it is that most people don't put on enough sunscreen to achieve that coverage. So no matter what SPF you're using, just make sure you use that, shot glass full for the body. The 3 or 2 finger rule, I think it was between, 2 or 3 fingers for your face and your neck. So it's just to make sure you use enough to be able to, achieve that amount of coverage with whatever SPF you choose.
Of course, I feel like a lot of the times we want to like limit the amount of sunscreen we put on our face just because we think it's either sticky or it leaves like a residue. So I think that just comes down to you finding the best, um, the best products, which kind of goes into this question that we just got before leaving. What are the 3 products um, that are your all-time favorite? Like if someone came in there like, what are the top 3 products, which would you get?
Oh, wow.
That's a hard question. That was good.
That's a hard question. Okay, so my top product that I will never put down is my retinoid. And I use a prescription from a company called Skin Medicinals. It was founded by a board certified dermatologist, and it's available to everybody. We can prescribe it to anybody. It's mailed to you from a specialty pharmacy. And what's great about it is that it's tretinoin, which is retinoid. You can pick your percentage, so between 0.025 and 0.1%, which is the strongest. And then you can also add ingredients that you need. So my particular one
Oh, that's
has,
so awesome. I've never
yeah,
heard of that.
it's amazing. It has hyaluronic acid in it, and it also has niacinamide. And so I know that every time I'm using my retinoid, I'm also giving a little bit of hydration, and I'm also using a product that will help combat some of my brown discoloration. You can also add azelaic acid, dapsone. I mean, there's just so many different
That's like
combinations.
the perfect mix. I think I need
Yeah,
that.
yeah,
I'm calling you after this. I need that. I use retinoid as well. And then
yeah,
I have hyaluronic acid on the side. So whatever I find for myself works best, I usually stick with, which we were kind of mentioning before. So it's been so awesome to kind of hear your top recommendations. I know a lot of people are hesitant to get not prescribed medicines. So whether it's a CeraVe or a Cetaphil, people are like, should I use them? Should I not? Um, so it's really amazing to kind of hear your insight on these types of products that people are using so often, because it just makes, I think, everyone feel better a little, because obviously it's coming from you who has experience with these products and really knows what works and what doesn't. So
right.
before wrapping up, my question for you is, do you have anything else you would like to share with our viewers? You guys, do you have anything else you would like to ask before you wrap it up and part ways? But overall, I'm so glad we were able to speak and really touch on all these amazing topics. And I really hope that we can do this again, because it is so important that these questions are answered, especially because they're super common questions that a lot of people just tend to not ask and just assume. So instead of
Right.
assuming, it's always great to have answers instead of having to assume.
That's right. Yes. No, I'll just say, I just wanted to say thank you so much. I see so many of my friends and patients,
Oh,
supporters on joining us today. If I did get to any of your questions, feel free to send me a DM on Instagram. And I'm so happy to do this. If you guys want more like specific topics, it's hard to cover everything in half an
of
hour.
course.
Honestly, so, if you want more specific topics, let us know. We are so happy to do it again, and just kind of hone in on like laser treatments or
Yeah, let's definitely do that.
yeah,
For everyone here, I think it's super important to hone in on those specific topics. Of course, like you just said, 30 minutes is not enough time. I can talk about skincare probably for hours.
yes,
So I'm so thankful for everyone that also tuned in. You guys are awesome. I hope you enjoyed Hope Beauty's talk with Dr. Mara Weinstein. And if you do have any questions, feel free to always reach out to us on our end, as Dr. Mara Weinstein said, her on her end. And we will be doing this soon, so keep your eye out.
yes, awesome. Thank you. Thank you
Thank you
so much.
so much. Have a great afternoon, everyone.
All right, bye.
Bye.